I would say 99% of the musculoskeletal surgeries that are done today do not need to be done now that we have regenerative medicine of stem cells and platelets. What's your hit on that, Dr. Grove? I know you do tons of research on this.
Yeah, so the thing is, we're seeing a lot of these failed surgeries. So I'm sure some people are having these surgeries and they're getting great outcomes. And if we can just do some simple set of injections instead of a big nasty surgery that comes along with a whole list of potential complications, we'd much rather go the conservative route and maintain safety for the patient. And Doc, like you mentioned earlier, we've got this amazing tool that's relatively new, which musculoskeletal ultrasound, where the definition is now higher than MRI. Like you mentioned, almost every single day I'm picking up a new diagnosis that was not shown on an MRI or a CT or an X-ray because of the dynamic nature of ultrasound. I can put some stress in that tissue, move that probe around, get a good three-dimensional orientation, and look at those tissues under stress, which is typically what we're going to do, live in our lives, right? You do a certain movement, you have some pain. So it's a really amazing tool that we can use to not only help diagnose, but do the treatment. So we want to avoid things like nerves and vessels. If I'm working on the chest wall, I don't want to pop a lung, I don't want to put it into the bowel, right? Anything where you're working with, deep spine structures,
yeah, the
you got to be
spinal
very
cord,
careful about that. We're really just maintaining that we're delivering those cells on target to where that pain generator is. To get back to the title of your book, regenerate that tissue and don't operate on it. Much safer way to go today.